The epigenetic theory of hair loss. Hi, I am Dr. Arvind Poswal. Today we will be talking about an alternate theory of hair loss. There is a conflict of interest as we have a company, Live Natural Products Private Limited, that specializes in providing anti-aging and gene therapy products for doctors as well as patients. We'll be talking about what causes hair loss, especially in androgenic alopecia, telogen effluvium, post-chemo or radiotherapy, post-COVID, or any severely debilitating infection. The incomplete hypothesis is the one where we say that DHT, derived from testosterone, causes hair loss in genetically susceptible individuals and hair. There are certain flaws in this. Testosterone peaks at 18 to 20 years of age, whereas androgenic alopecia occurs and progresses at ages when testosterone levels are actually decreasing. Telogen effluvium is not connected directly to our testosterone levels, but to our overall body health and stress levels of our body. Lastly, DHT blockers alone do not reverse hair loss consistently. Let's have a new look at etiology of the hair loss, epigenetics. There are over 215 gene loci that modulate hair growth and hair loss. The gene effect is therefore not limited to only two choices, namely hair loss and hair growth. The sum total of the effect of these gene loci can decide how many of the stem cells survive in each hair follicle. A hair follicle may contain both types of stem cells, those susceptible to androgenic alopecia and those not susceptible to androgenic alopecia. Thus, in some instances, we may notice thin hair surviving in balding areas throughout life because they may have some long-lived non-susceptible stem cells. Similarly, thinning of the hair in scalp-safe donor area with presence of miniaturized hair. Assume that they may also have some susceptible stem cells. We are born with the genome, but we constantly create our epigenome. That determines the expression of the genome, which in turn decides the nature of all things that happen. Epigenome, the word means epi, that is above the genome. So epigenome is above the genome. It consists of chemical compounds that modify the genome in a way that tells it what to do, where to do it, and when to do it. Different cells have different epigenetic markers. The epigenome tells the cell to become a hair follicle or a liver cell. Epigenome is a set of chemical modifications to the DNA and its associated proteins which alter gene expression and are heritable. These modifications occur as a natural process of development and tissue differentiation and can be altered in response to environmental exposure, chemicals, disease, etc. In short, epigenome can be considered as being 5 things: the food we eat or drink, the respiration, the breath we take, the things we apply on our skin, and the hormones that are produced in our body. Understanding the generational epigenetic shift. In the past 20 years in developing countries like India, diet and lifestyle changes have led to a generally unhealthy epigenome. As a result, numerous lifestyle diseases, heart disease or metabolic disorders like diabetes or baldness, now occur at an increasingly young age. This epigenome worsening is clearly linked to gradual deterioration of our environment, our diet, and the general stress levels. People in such situation are losing hair 10 to 15 years earlier than the previous generation. An often heard patient statement: my father was also bald, but his hair loss started in his 30s or 40s, whereas I am losing hair since 20 years of age. In developed countries, you may not see this very clearly because there the epigenome shift occurred almost 30 to 35 years ago. So you will have to compare the patient's hair loss age with their grandparents. So let's see what happens to the hair. Hair is a complete organ by itself which has specific nutritional requirements. It is also the fastest growing organ of the body and is very metabolically active. Stem cells in the dermal papilla and bulge area of the hair follicle multiply, leading to hair growth, which is called anagen. When for any reason the stem cells do not multiply, hair growth stops, telogen. The stem cell growth or attenuation occurs under the guidance of chemical signals or proteins produced by the cells themselves or by various entities in the vicinity. The process or algorithm of hair loss. An unhealthy epigenome creates condition in the hair follicle that one weakens its root sheath. Secondly, it creates an unhealthy environment in the hair follicle that induces the stem cells to escape. It also makes the hair more susceptible to ill effects of DHT, and the cells turn senescent or senile, especially the melanocytes. These senile cells secrete cytokines that turn nearby cells also unhealthy or senescent. All the above factors combine to make the hair weak, small, and without melanin. You may note that one often sees emergence of white hair followed by more hair turning white in vicinity. Look from the knowledge of melanocytes turning senile and then turning nearby cells senile. Explain this usual observation of one hair turning white followed by nearby hair also turning white. Now in a miniaturizing hair, the melanocytes are the first cells to turn senescent. Senescent cells are aged cells that do not die, nor do they perform their routine functions. Instead, they secrete harmful cytokines that gradually harm the nearby cells, leading them to become senescent as well. The stem cells do not multiply as vigorously as in a normal, strong terminal hair. Now we have to look closely at the stem cells and the cells in the hair follicle to understand the genesis of hair miniaturization and hair loss. The hair follicle consists of stem cells in the dermal papilla and the bulge area. There is chemical signaling in between both these parts even when it is in a resting phase. This signaling is chemically mediated. Different enzymes are produced in various phases. As our understanding of the events at a cellular genetic level improves, we see how certain chemicals change signal of the stem cells to increase or slow down active multiplication. Multiplication of the stem cell and associated cells of the hair fall ensures a growing hair follicle. Non-multiplication or reduction in number of stem cells leads to miniaturization. As these cells slow or cease multiplication, the hair miniaturizes and ultimately dies. Assuming that all the stem cells in that hair follicle were genetically susceptible to androgenic alopecia. Those hair follicles in which only a proportion of the stem cells are susceptible, the hair will miniaturize, but it will not completely die off. This explains many individuals who retain some miniaturized hair even in extreme old age. It also explains the occurrence of hair miniaturization in the safe donor area of the scalp. If we extrapolate this, we can explain telogen effluvium and post-chemotherapy hair loss and many other hair loss, where most of the stem cells may be temporarily shocked into inactivity. When the conditions turn conducive, these stem cells start multiplying again and hair regrowth is seen. The hair follicle can be observed as contents of a pouch, the pouch being created by the root sheaths. The dermal papilla melanocytes, keratinocytes, fibroblasts, etc. have a complex interaction within this tubular pouch. In a healthy follicle, all the different cells are healthy and interact with other cells and surrounding structures, leading to a healthy hair growth. Disruption of this healthy environment can disrupt hair growth. It can lead to weakening of the root sheaths by reducing the intercellular adhesive bonds, leading to the escape of stem cells into the surrounding tissue. At this stage, harmful chemicals and DHT can also start damaging the hair follicle. Severe illness or physical stress, example severe infection, can do the same. Pregnancy and childbirth brings changes to the hormonal composition of the blood, and the follicle is actually bathed in blood. Blood provides it with all the nutrients and the oxygen. The availability of required nutrients similarly affects the follicle health. An acute shortage of nutrients will lead to starving of the fast multiplying cells. This can be seen as hair transitioning from anagen to telogen and eventually follicular miniaturization. Toxic chemicals can be exogenous as well as endogenous. Exogenous will be result of environment pollution, chemicals in diets, chemotherapy agents, hair products, etc. Endogenous will be due to stress or DHT, leading to changed internal environment of the hair follicle. Similarly, there will be more situations or harmful chemicals or radiation that may harm the constituent cells of the follicle. One such instance is when melanocytes turn senile. A senile melanocyte will secrete harmful cytokines. It will signal the nearby cells to become senile as well. These chemicals secreted by the melanocytes make the environment enclosed by root sheaths non-conducive to healthy hair growth and multiplication of the stem cells. One such instance is when the melanocytes turn senile. A senile or senescent melanocyte will secrete harmful cytokines which signals nearby cells to emulate its behavior. The chemicals secreted by the melanocytes make the environment enclosed by the root sheath not conducive to healthy growth and multiplication of stem cells in the follicle. Also, the stem cells follow the gradient of nutrients and healthy environment and escape the increasingly porous hair root sheaths. Here you can see a video where the stem cells are seen escaping the hair follicle. Telomere, Hayflick limit and stem cells. It's important to learn about all three of them. Telomeres are located at the end of the chromosomes and maintain the integrity of the genetic material during cell multiplication. Repeated cell division erodes the telomeres till they become too short to maintain DNA integrity. The number of times a cell can multiply before the telomeres become too short is called the Hayflick limit. Till recently, Hayflick limit was considered unchangeable till our understanding of TERT. Stem cells continue to multiply till their telomeres become too short. TERT, that is telomerase reverse transcriptase, is a RNA protein that re-elongates the telomeres if they are very short. Once telomeres have reached back to the functional length, the stem cells start multiplying. Resveratrol and fisetin, both anti-aging compounds, once introduced intradermally, increase TERT expression. This leads to rejuvenation of the stem cells in the bulge area. This is an interesting approach to hair growth. Harmful toxins as well as DHT can be considered as capable of damaging hair only when the epigenetic shift weakens the hair. This holistic view may explain many observations in hair loss, including variable age of onset of androgenic alopecia, telogen effluvium, including post-chemo and radiotherapy, hair miniaturization in the scalp donor areas. In conclusion, epigenome is affected by our lifestyle and diet. An unhealthy epigenome will hasten the onset and progression of androgenic alopecia or baldness. Conversely, epigenome optimization may help delay hair fall and help recover from premature androgenic alopecia and telogen effluvium. It's important to understand the events occurring at the genetic level to devise treatments for the same. More molecules are being tested, example rapamycin, that can prolong the life and color of the hair at a genetic level. We need to have an open mind and study these and to incorporate them in our treatment strategies. Thank you.